Greetings, everyone, and thank you for joining me on this episode. I have a dear friend joining me. As my guest is Corinna Kelley, and we were starting to do more of a catch up. I said, no, let me hit record so we can get all this on the episode. My name is Dr. Charlotte Huntley, in case you're tuning in for the very first time. I'm your host. I'm a public health entrepreneur with over 25 years of experience in healthcare and public health. And I've supported a lot of entrepreneurs along the way. So my guest today happens to be one of those entrepreneurs. We've had the opportunity to work together in person, and I am just such a big fan of what she and her husband do with their business. But we're going to get to know a bit about her and her journey through this episode, the conversation here. So Corinna, introduce yourself and tell everyone a bit about your business.
Yeah, well, it's so nice to be here again. It's been a while. I was looking back. I was like, I think it's been since before the pandemic when I first showed up on this show. I can't remember, but oh my
Oh,
God, so
yes,
much has changed
that's right.
since
Well,
then.
you were on the Public Health Epidemiology Conversations podcast for sure.
Yes.
And then we launched this podcast this year. Um, so, yeah, our worlds overlap way back.
Yeah, and I met, Dr. Huntley many years ago. So, and kind of started following you in my beginning search of, entrepreneurship. And I think it was I think what the great thing about public health is, finding entrepreneurs that are just in public health that are very friendly and open to wanting to offer advice. So again, I'm Corinna Kelley, and I'm very excited to be here. I'm been in public health for over 18 years and have a very diverse background and have been in many different specialties. From community health to entomology. I've worked emergency management, infection control. I've worked in hospitals, health systems, community or health departments, as well as nonprofits, multitude of different areas. And I also come from a very just multiracial background. I've actually raised Black and Hispanic. So cultural tradition is such a huge part of my life and my upbringing. And even before joining the Air Force, I actually served in the Air Force for a couple of years and served with numerous diverse group of individuals. So diversity, inclusion, and culture have always been a part of who I am and a big part of my life. And what I realized after separating the military, and it kind of goes into why I started this business and what it really means to me and also my husband who's also a co-owner. But transitioning out of the service kind of went through a really rough transition from military, coming from a very welcoming team oriented culture, right, of camaraderie, very inclusive, very transparent on as far as promotional opportunities and growth, lots of opportunities for leadership development, education. And so coming from that background and switching out and coming to the civilian workforce, really kind of struggled in trying to adapt, right? And trying to understand this new kind of landscape. And one of the things that I was missing, and even my husband, who served a lot longer, over 20 years, was culture, right? And feeling connected and also feeling embraced when we come into, these different organizations. And so that's really what C.R.E.I.D stands for. And so that's we're co-owners and founder, CEO of C.R.E.I.D Consulting. And really what C.R.E.I.D stands for is culture, resilience, empowerment, inclusion, and development. And so what we're doing is empowering growth and resilience and purpose-driven cultures and doing this in support of individuals as well as communities and in organizations, and helping to develop a growth mindset so that people can thrive and live their best lives. So what we really help to do is not only for working in organizational cultural transformation, so helping out organizations with the organizational development or leadership development, but we also work with individuals and utilize a lot of our skills in leadership and coaching and mentorship to establish and teach servant leadership, which is really a big philosophy of what we we teach and what we've learned throughout our military careers, and really how to put people first. What we learned and really apply is that people drive the mission, right? That people should be the first and foremost. If you take care of your people, they will take care of the mission. And so kind of implying that mentality in the organizational culture will really help influence, the people that work there, as well as what they do and who they serve, right? So kind of be that extension to that community. So if you take care of your people, they'll take care of the mission, which are the people that they take care of. And so we also help out with some community engagement and how to engage with these community as well as your shareholders, and change management. So a lot of resiliency is a huge part of what we've learned over the time, as well as what we're taught in the military, is how to be adaptable, right? How to be flexible through different changes. And having gone through numerous changes, I think I was talking to Dr. Huntley about I was like, I think I'm home now in Tampa. But I haven't moved yet. So 5 years here. So I think this is home, but I'm so used to moving, transition, all these moves. It's just kind of really easy to kind of get up and go. So, but teaching people how to do that transition and to be resilient through those changes.
I enjoy hearing you. For me, it's a reintroduction, but I'm really connected, and so much of what you describe resonates with me. That's heart-centered, where you're a servant. How can I help you? And really leading with that, being who you are, and then it makes it easy to connect and attract the right type of clients your way and opportunities. I'm curious to know, and I do remember we've had conversations. I see your diverse background as such a strength. It's very much power positioning, preparing you for all the different opportunities that can be coming your way. Kind of rolling back time a bit, do you remember when you first became interested in public health as a career?
Yes. So I would say, I always tell people this, it's like public health chose me. I never chose public health. And it's really true. So because I came into the military at 18. So, joining the military, I came in open general, which means that the Air Force really picks a job for you. And so within that last week, it's a funny story, but that last week, basic training, they give you your jobs and your assignments, right? And so mine, I opened it up and it says public health. I'm like, what the heck is public health? And they're like, oh, you work in the DFAC. I was like, the DFAC? The DFAC's our kitchen. And I was like, I don't know how to cook. I'm not going to be in the DFAC. And the girl next to me is hysterical. She's crying because she got security forces, which is a cop, right, in the military. And I'm like, oh, I'll change you. I'll be a cop. Can we change? Can we trade? And they're like, sure, go ahead and try. And failed attempt. We couldn't try. We were already locked into our assignments. We were already locked into where we're going to go for training school. And so I had to go to public health training school for 13 weeks. And once I got there, the first question they asked was like, who doesn't want to be here? And my hand went straight up. And they were like, give us some time. We'll change your mind. And I was like, good luck. And so one thing you can do in the military is after, so many years in, you can cross train. So you can pick a different career field. But after those 13 weeks, we would go through like in-depth, hands-on training at public health we were out in the field, like actually catching mosquitoes and, looking under a microscope and, counting our different trapped mosquitoes after we took them out of the freezer. We were out, in the field, we we're building bear bases. We're looking at hospitals and trying to set up, how we would set up a hospital system or doing interviews, community health interviews, STI interviews, things like that. So we kind of learned every aspect in a very short time before we get to our base. So we kind of have like a foundation. And I loved it. I was like, this is something that I can do. And so throughout my career, I, really progressed, and I stayed in public health the entire time and served with a lot of people who kind of were not for public health. So can you imagine being in public health and everybody who's in there are like, no, I can't wait to get out of this career field. I do not like it. And I'm the only one that's like, yes, I love this. So getting out, once I got out of the service and going to the health department, I'm like, ooh, I got a lot of people at these and, people who are just loving this stuff. And I worked in community health straight out of the military. And it was just being surrounded by people who really enjoyed the work that we did. Really, I think drove my passion and drove my focus into community health. So I kind of stayed in that path, and I did a lot of field work in like boots on the ground and really kind of work with the community in a health system, working like a mobile health care clinic after the health department, and kind of seeing and working with those individuals, seeing really firsthand some of the needs that we talk about, that when we deal with community health needs assessments and implementation strategies, but actually seeing firsthand what individuals are going through. And I think that was where my attention was like, I can help, right? I can help be a voice for these individuals and utilize my skills to help elevate those voices.
That's interesting. When you were talking about just like following the story, when you talk about the field work and like trapping the mosquitoes, I literally just shared that story with another. I was interviewing a little earlier for a different episode, but we were talking about. I feel like when I was in microbiology, I kind of turned a corner and went down this trail into virology, and I was doing all this work that I didn't sign up for this. I was like doing rabies testing, and then I was talking
Oh,
about how I was in like level 3 biosafety, level 3 like grinding mosquitoes and getting ready to test for West Nile virus. I'm like, why am I messing around with mosquitoes and these little vials? And
no, yeah, don't put me anywhere near entomology. I do That is not my field. I did not like that. So I definitely wrote that, check that off the list as like, I
yeah,
know how to do it, but don't ask me to.
right.
Yeah.
So, in listening, to your background, a bit, and thinking about kind of where you are now, how has your previous experiences helped prepare you for this journey of entrepreneurship and consulting?
I've taken I think my journey has just been kind of all over the place. I think not only from the skills that I learned in the military, I think, I learned lots of different skills in regards to leadership. I actually trained and was a trainer for John C. Maxwell, a big leadership, and actually did train the trainer courses for developing the leader within you, and did a whole series on that for active duty military members. And so learning some of those leadership, qualities and perspectives, and being able to apply that now as an entrepreneur in C.R.E.I.D, I think is really, it is really beneficial, as well as resilience. I was a master resilience trainer while I was active duty. And so one thing that I noticed in once I got out the military and I was working at the health system during COVID-19, and I actually left the health system during that time, and I was working out in the field. A lot of our work had changed, from working directly with patients and to how we were, providing that care. And so what we did a lot of was kind of supporting different needs that they had, social needs, supplying food or resources that they needed. And in doing that, kind of seeing some of, losing a lot of the healthcare workers that we were losing, seeing a lot of the burnout and some of the stress, I started to apply some of those skills, in resiliency, and kind of teaching and coaching and facilitating some of that throughout that time, and really realized, I was like, well, this is something that we really need in public health, is to be able to be flexible, to be adaptable, but we're not getting that training in the outside world. And so I think you being able to see that perspective, because in the military we had to be ready for everything, right? For anything and everything. We were constantly training, every day. It was always a training. And so having that mentality of always being ready, not only mentally, but physically, emotionally, spiritually, and being able to know and understand that. And I'm like, well, I can create something and maybe be able to assist, in our field, and support those efforts. And so utilizing those skills, I've been able to apply that in C.R.E.I.D and in entrepreneurship. And then also, I have mentioned before, is meeting so many entrepreneurs in the field of public health, you included. I think, meeting you early on and following, all of these discussions, sitting in a master class and actually watching all the presentations of various different entrepreneurs and where they were at in their journeys, and how they had utilized their skills and put together, services and programs, and how they were pricing these and excelling in their fields, and then actually meeting you firsthand. And I think what I enjoyed meeting you firsthand in person was that the belief that you had for us in what we were doing, and being able to kind of show us like, okay, this is what you're doing, this is how you can do it, specifically, for each one of our specific niches. Right?
Yeah. I appreciate that. Yeah, that's sometimes I feel like, oh, I get to do this, and this is like, a part of my work. I think it's important for us to in seeing the growth of public health and how we're going to be able to serve the communities that we care about, and really address the challenges and the issues that matter to us the most.
Mm-hmm.
A part of that is being able to connect with something that's really driving us internally,
Mm-hmm.
and seeing that come together, helping people to connect to that and articulate that. It's like a treat for me to be able to witness that. It's very
Mm-hmm.
much like, but I know that on a bigger scale, that is how we're going to be able to really move the needle and
Mm-hmm.
make the difference. And really very much like you've described you and your husband, you noticed something was missing in this transition, just starting there, you notice something missing, and you all put your heads together, and then start to create something that would address it. And you've
Mm-hmm.
continued to do this over and over, and including what you're even working on now, and being able to do that and seeing that change. And I think it's something that we, as being in the position, it's hard for us to see the value, because it's like
Mm-hmm.
we see what's missing, or we see it's not working or whatever. But I think that when you like this conversation, I'm hoping that you'll listen to this episode when it comes out, because hearing your journey, you'll sometimes it's great to take that retrospective view
Yeah.
to really be able to see, where you've come, how far you've come, and the impact that you're able to have as well.
Yeah.
It's really great.
Yeah, definitely.
So, do you operate your business, like, is that the sole focus, or do you have another job that you work along with running your business?
We have two businesses. I was telling Dr. Huntley, we were actually working on a rebranding because I'm trying to merge them. So entrepreneurship, and I know you'll get to asking that question, but lots of learning in entrepreneurship, lots of different
Yes.
ways to do things. And so kind of working on that. We do still we do still have jobs, but we work contractual work. And so in doing that, and so pick up different jobs doing that. And then also, work collaboratively with others on different contracts.
Okay. There's nothing wrong with that. I think that's great. I think that's really great. Now, those that are listening and are just getting started, that's not what I'm recommending. Don't go out and have multiple businesses right now. But I do think that sometimes that is good, that there is a clear separation, and that could be a good setup for the right people and the structure and so forth. I won't go
Mhm.
down a rabbit trail, but just don't take part of what you heard and go, oh, let me just go ahead and start two new businesses at the same time.
No, I know the another process is, like I said, we're merging. So
Yeah.
in trying to merge, different branding, and because does get confusing
Yeah.
with a lot of the same types of work, but we were thinking two different things initially, and kind of,
Yeah.
have to
I
revisit.
I think it can help you streamline. I think I call it trimming the fat. Keep a very lean business focus on, because you could do a lot of things really well. So it's hard to choose if it sounds like you all are in that situation. So
Mhm.
it's not like it's wrong. It's just you're streamlining, and
Yeah.
it'll be very good. So I like to sort of a wide variety, not just all the pretty parts, but maybe the not so pretty parts. So I have two questions, and I'll ask them at the same time. You can answer them one each. But I'd like to know first, what do you like most about consulting and entrepreneurship? And then share with me what you like least about consulting and entrepreneurship.
What I enjoy most is the creativity. So just being able to create whatever it is that you do, and do it, do the best at it. I had a great opportunity to create, for instance, I did a resilience and change management workshop for West Virginia University, and for their institute that was going through, and as their public health institute, and going from, changing their whole department, and shifting the way they were doing and operating. And so creating a really engagement, workshop on resilience and incorporated meditation. So being able to do that on my own and being able to utilize some of the skill sets that I want to include in my work and the things that I'm learning and that I'm incorporating in my life, and being able to utilize and actually see the value and having people come out and, very excited about the way that we approached it. And then also kind of incorporating some of the things that we did military wise into that presentation and into those workshops, I think were very eye opening because people got to see a whole different perspective. And so, but being creative in putting something together like that is a lot of fun. So I think I enjoy that the most. And then also being able to collaborate. I collaborated recently on a CDC Foundation opportunity with other women entrepreneurs, and did some facilitation with some veterans and learning about some evaluation projects that they were working on. And so being able to decide who I want to work with, and being able to work with people who are like-minded, who have the same type of work ethic that I do, and people who can offer different insights so that they have different sides of creativity and I can learn something from them. So I think that's the best part that I enjoy the most. I'm actually part of We Collaborative, which is public health entrepreneurs, women entrepreneurs, and it's great. So we get a really good chance to collaborate on different contracts together and work together on really just growing as entrepreneurs. And so we learn a lot from one another. And I think the least part that I like, the part that I don't like, I think all the finance stuff. So is taxes that once a year, but I don't like regular taxes either. But I think the taxes, financial liability stuff, and definitely having to hire somebody for those entities. But I think initially we're kind of trying to tackle a lot of that stuff initially on our own. It was over, a little cumbersome. So those are, I think, the aspects that I don't care about too much, and that get a little bit difficult.
Oh yes, I think you probably remember my whole. I took like 2 minutes to speak on that at over in Orlando a couple years back, and I said just hire a bookkeeper and get a really good
Oh,
accountant.
oh my goodness, yes. Once I got a really good tax person, and she looked at my records and she goes, "Really?" I was like, "I know." It's like, "Please help me." Please help me. She fixed everything, and I was like, I'm going to keep it like this. I would keep
Yes.
it like this.
That is not my area as well, so I feel your pain.
Definitely.
Absolutely. Well, I have really enjoyed our conversation so much. I have one final question, and this I think gives a great way for you to just summarize things nicely because we've talked. You mentioned a lot of people mentioned that they love the creativity that's a part of this. So my final question for you is: in what ways are you creatively advancing public health with your business?
Creatively, I am able to apply a holistic approach. So, I think, like I said, after leaving the military and having such a difficult transition, I really got into, and, I really experienced a lot of, depression and dealt with mental health. And so I went through my own holistic wellness journey and, learned about mindfulness, learned more about resilience, and learned how to facilitate, different trainings and educations. And so being able to provide that, what I was able to utilize out of it to others, especially those that provide services to other people, compassionate care, health service workers, or even those, firefighters, police officers, and also those service members that are doing things for other people, but teaching them how to put their mask on first is what I like to call it. So I think that's what I'm trying to do first is foremost in public health specifically is teach them the importance of that self-care and that self-awareness and that self-reflection and being able to take care of ourselves so that we can be able to take care of the other things that we need to in our career fields as well as our lives, and be able to move in the directions that we are trying to go. I think the other areas that trying to work on is the organization. So I think we're having a lot of shifts in public health. We've had a lot of different changes, and change is hard and change is difficult, and everybody reacts differently. I call it, when I teach, there's a change, which is just an event that happens. And then there's a transition period, which is our individual way of dealing with that change. And so my transition period from, getting out of the military, my change was immediate, but that transition period took me about 7 years, and that's okay. And some people, that change is going to happen, but transitionally, that's going to may take them a little while. And so being able to teach and to educate and to assist organizations through some of those changes, but being able to understand that we're all human, and that leaders, being able to look at, individuals within their organization and being able to approach it that way, as we're not machines, we're humans. And so this is how we interpret changes and differences in the organization. And these are better ways that we can go about it. So applying that kind of mentality to organizational changes, cultural changes.
That's nice. Very nice. I internalized that for myself. Got some messages out of that I needed to hear. So thank you
Yeah.
so much, Corinna. It's been so nice to catch up with you and to hear about the things that you're doing now, and even this bit of this rebranding that you all do. I'm excited to see, how you bring the two businesses together. Yeah, thank you for taking time and being on the podcast with me today.
Well, thank you. Thank you for everything that you do. Thank you for being here today. I know it's a lot, and that we appreciate everything that you do. And I follow you, and I encourage more people to follow Dr. Huntley, to subscribe and to listen, as she's doing phenomenal work. And to any entrepreneurs out there, keep doing what you're doing. Always look out and reach out to any public health entrepreneurs that are doing good things that you're interested in. I think our field, we're very open and always willing to assist.
Yeah, I think that's great. Thank you for that. And I will also make sure that you all have links to connect with Corinna in the description for this episode, as well as the show notes. So thank you all. And until next time, have a fantastic rest of your day.